procedure, I feel just absolutely happier. I'm a different person. I came on out of nowhere, just woke up one day in excruciating pain. I was cranky. There was obviously friction in my marriage, work life. On top of that, I wasn't able to exercise, so that was a way that I got a lot of my stress out of my life. There was a number of times I couldn't play hockey. Before the procedure, I was dependent upon pain medication. That was one of the only ways that I could get comfort to get through the day or even get to sleep. Sometimes I would wake up and have to take medication just to get back to sleep. Throughout the physical therapy, we did epidurals as well. I think I had a total of about 9 epidurals throughout the 2.5 years. Definitely not interested in living the rest of my life constantly, getting surgeries. There were a few times during this 2.5 years that I definitely felt there was no way this pain was going away. Definitely did not see a light at the end of the tunnel. Dr. Wilson, when he first brought up this idea of hydrodiscectomy, it sounded great. It looked like a very easy procedure, in and out, and very, very low recovering time.
My name is James Wilson, MD. I'm an interventional pain physician here in Naperville, Illinois. The SpineJet technology is remarkable in that we don't use any heat, we don't use anything that causes scar tissue. And the ability to go into a disc and with just the power of water remove part of a disc without an incision is tremendous.
The reason I chose the hydrodiscectomy was that it is minimally invasive. The recovery time is very short, and there really is no incision for the surgery.
The beautiful thing about using hydrocision is that we don't need an incision. The patient is awake during the procedure. The recovery time is minimal.
In order to alleviate some of the concern for my wife in regards to this procedure, I showed her the recovery time and how that was going to fit into my life. I didn't have 6 months to take off from work to recover, so being able to recover quickly and get back to work, that was the main incentive or reason that we chose to go with it.
The actual hydrocision portion of the procedure takes about 3 minutes. Front to back, in the room, out of the room, is about 20 minutes.
Before I knew it, the procedure was over. But the most shocking part was about a week after is when I really started noticing a difference. My back was a little stiff from the procedure, but the pain down the leg, your typical symptoms from a herniated disc, a lot of them were gone.
At approximately 3 months, they're going to know how good they're going to be. But we've seen in other cases where after about 6 weeks, people have actually felt no pain and felt great.
A lot of my friends were so surprised by my recovery time. They couldn't believe that I had back surgery and was back playing hockey and softball with them after 6 weeks. Since the procedure, I have experienced significant pain relief.
With the simple jet of water on the inside of the disc, we can remove part of the disc and it leaves no scar tissue whatsoever. So it's the technology of the device itself that makes it magical.
This was definitely the right avenue to go, and my life is completely different and much better because of this procedure.
I think hydrocision and use of this technique is the best thing to come along in my career.